What I'm about to share will completely change everything you thought you knew about managing high blood pressure at night, and your doctor has probably never mentioned any of it. Here's something most people don't know. Your blood pressure doesn't just sit still while you sleep. It moves. It shifts. And for millions of people over 60, it quietly climbs during those dark, still hours, doing damage that doesn't show up until it's already serious. Now, what if something as simple as what you drink before bed could change that? One of the drinks I'm going to show you today is one most people have never even thought about. But the research on it is real, it's peer-reviewed, and it shows it can drop your systolic blood pressure by 7, 10, even 15 points overnight. That's not a small number. That's the kind of result some medications aim for. But here's what worries me. Right now, many people are drinking things before bed that are quietly pushing their numbers in the wrong direction, and they have no idea. And at the same time, they're missing out on some of the simplest, most powerful tools for heart health that exist. Tools sitting right there in the grocery store. That gap is the problem. And it's one I see every single day working with patients who are managing hypertension and looking for real answers. As a practicing physician who works with hypertension patients every day, I can tell you, this information rarely makes it into a standard doctor's visit. There just isn't enough time. That's exactly why I made this video. So stay with me. Because what comes next could be the most useful thing you do for your heart health tonight. I specialize in cardiovascular health, and the number of patients I see who are doing everything right but still struggling with nighttime blood pressure is staggering. They're taking their medication. They're watching their salt. They're trying. And yet something is still off, especially at night. Here's a scenario that plays out more often than most people realize. A woman in her late 60s goes to bed feeling fine. Her daytime readings have been decent. Her prescription is filled. She believes things are under control. But between 2 and 4 in the morning, while she's fast asleep, her blood pressure surges. She doesn't feel it. She has no idea it's happening. And yet, night after night, that silent surge is putting quiet strain on her heart, her blood vessels, and her kidneys. This is called nocturnal hypertension, and research shows it can be even more dangerous than high daytime readings. The hard truth is this. Your doctor gave you a prescription. What they likely didn't give you was a bedtime protocol. And that's not a criticism of your doctor. Appointments are short. The system is busy. There's only so much that can be covered in 15 minutes. So the nighttime piece, the part that happens when no one is watching, often gets left out completely. That's a system problem, not a you problem. And if you're a woman over 60, managing your blood pressure and looking for simple, natural things you can do at home starting tonight, then this video was made specifically for you. You don't need complicated routines. You don't need expensive supplements. What you need is the right information. And that's exactly what we're building toward right now. Here's something most doctors never get the chance to explain, and it changes everything about how you think about sleep and blood pressure. In a healthy body, blood pressure is supposed to drop during sleep, not stay the same, not rise, drop by around 10 to 20%. This natural nighttime dip gives your heart a much-needed rest. It lets your blood vessels recover. It protects your kidneys. Your whole cardiovascular system uses those quiet nighttime hours to repair and reset. So why does this happen? One key reason involves the inner lining of your blood vessels, called the endothelium. This thin lining produces a molecule called nitric oxide, which helps blood vessels relax and widen during sleep. When nitric oxide levels are low, blood vessels stay tight. Blood pressure stays high. And here's what's exciting. Certain natural compounds found in specific drinks can actually help boost nitric oxide production. I saw this clearly with one of my patients, a 68-year-old retired teacher. Her daytime readings looked acceptable, but when she wore a 24-hour blood pressure monitor, her nighttime readings came back at 145/90, night after night. She was a non-dipper and had no idea. So what can you actually do tonight, using things from your own kitchen, to support healthier nighttime blood pressure. That's exactly what we're getting into right now. I'm going to share 3 drinks, ranked from beneficial to most powerful. Don't skip ahead, because number 2 is actually what helps number 1 work even better. Trust the order. Thicker blood means your heart works harder to push it through. Staying hydrated before bed helps prevent that. But the lemon adds something extra. It contains a flavonoid called hesperidin, which research has linked to relaxing and widening blood vessels. And the potassium in the salt substitute directly counters the blood-tightening effects of sodium. A landmark study in the BMJ, along with the broader DASH diet research, shows that getting enough potassium daily can lower systolic blood pressure by 4 to 8 points on its own. One important caution: if you take potassium-sparing diuretics or have kidney disease, speak with your doctor before adding potassium, even from a salt substitute. That's a solid start. But drink number 2 targets something far more specific to what happens to your blood pressure during the night. Drink number 2, unsweetened Tart cherry juice. A 66-year-old patient with poor sleep and stubbornly elevated blood pressure added just 8 ounces of Tart cherry juice 1 hour before bed. After 6 weeks, her systolic average dropped 7 points, and her sleep improved measurably too. Tart cherries are one of the very few natural food sources of melatonin. Most people think of melatonin only as a sleep aid, but research published in Nutrients shows it also has a direct, mild blood pressure lowering effect, especially during nighttime hours. Tart cherries also contain anthocyanins, plant compounds that reduce inflammation in blood vessel walls and support better endothelial function. A randomized trial in the American Journal of Clinical Nutrition confirmed Tart cherry juice reduced systolic blood pressure by an average of 7 mmHg in older adults. Just make sure you choose unsweetened Tart cherry juice, not the sweetened cocktail version. Added sugar works against everything you're trying to do here. Stick to 8 ounces, that's the amount the evidence supports. Both of these drinks are genuinely useful. The science behind them is real, but neither of them comes close to what drink number 1 does to nighttime blood pressure. And honestly, the research on this one surprised even me. Before I reveal number 1, and I promise it is absolutely worth the wait, I need to say something directly to you. If you have been managing high blood pressure for years, doing everything right, and still not seeing the results you want, you are not failing. You are simply missing some information. And filling that gap is exactly what this channel is here to do. If this video is helping you, please subscribe and share it with a mother, sister, or friend who is dealing with the same thing. You might be passing along something that genuinely changes their health. I don't say that lightly. Now, drink number 1. Studies have actually compared its effects to certain blood pressure medications. I'm going to give you the exact drink, the exact amount, how to prepare it, and when to take it. Stay with me. This is the one that makes everything else worth watching. Drink number 1 is hibiscus tea, and the story behind it is worth every second you've waited. One of my patients came to me with systolic readings that stayed consistently above 150, even with medication. She was frustrated. She was doing what she'd been told, so we added one specific hibiscus tea protocol to her evening routine. 6 weeks later, her nighttime systolic readings had dropped an average of 13 points. Her diastolic dropped 7. Her own physician reviewed her numbers and reduced her medication dose. So what makes hibiscus so powerful? The hibiscus plant, specifically Hibiscus sabdariffa, contains natural compounds called anthocyanins and organic acids, including hibiscus acid. These compounds work in your body the same way a common class of prescription blood pressure medications works, as ACE inhibitors. ACE stands for angiotensin-converting enzyme. What that means in plain terms is this: your body produces a hormone called angiotensin II that tightens and narrows blood vessels. Hibiscus naturally reduces that hormone. Less of it means more relaxed, wider vessels, and lower blood pressure. Hibiscus also has a mild diuretic effect, gently reducing fluid volume. Again, the same dual approach used in pharmaceutical treatment. The clinical evidence backs this up strongly. A meta-analysis of randomized controlled trials published in the Journal of Nutrition found hibiscus tea lowered systolic blood pressure by an average of 7.2 points and diastolic by 3.5 points. A study in the Journal of Human Hypertension showed reductions of up to 11.2 points systolic. And researchers at Tufts University directly compared hibiscus tea to hydrochlorothiazide, a widely prescribed blood pressure medication, and found the tea comparably effective in prohypertensive patients. Here is exactly how to prepare it. Use dried hibiscus flowers or a pure hibiscus tea bag, just a single ingredient. No blends. Use 1 to 2 teaspoons steeped in 8 ounces of water that's just off boiling. Steep for 6 to 10 minutes. The longer you steep, the more beneficial compounds you extract. Drink it 60 to 90 minutes before bed. Give it 4 to 6 weeks of consistent use before judging the results. If the tartness is too strong, a small amount of raw honey is fine and won't meaningfully affect your blood pressure. Now, a few safety points that matter. If you already take blood pressure medication, please monitor your numbers carefully. Hibiscus is genuinely active, and combining it with medication could lower your pressure more than intended. If you take hydrochlorothiazide specifically, speak with your doctor first as there is a known interaction. Hibiscus is not recommended during pregnancy, and if you tend toward low blood pressure, approach this one cautiously or skip it altogether. This is powerful, natural, and proven. Used correctly and with your doctor's awareness, it can be a genuine game changer. So let's bring it all together, because the full picture is even more encouraging than each drink on its own. You now have 3 evidence-based options. Warm lemon water with a potassium-based salt substitute for hydration and blood vessel support. Unsweetened tart cherry juice for melatonin, better sleep, and reduced vascular inflammation. And hibiscus tea, the most clinically validated of the 3, working as a natural ACE inhibitor to actively bring your numbers down overnight. And here's a question I know you're probably asking right now: can you use all 3 together? Yes, absolutely. The effects appear to be additive. You don't have to pick one and skip the others. In fact, the difference between a patient using all 3 and a patient using none is striking. One of my patients, a 69-year-old retired nurse already on a low-dose blood pressure medication, added all 3 drinks to her evening routine and committed to a consistent sleep schedule. Over 8 weeks, her nighttime average moved from 138/86 down to 124/78. Her cardiologist reviewed the results and called it lifestyle optimization at its best. Here is a simple nightly routine you can start tonight. At 7 p.m., have 8 ounces of unsweetened tart cherry juice with or after dinner. At 8:30, begin winding down, dim the lights, and step away from screens. At 9 p.m., sip your hibiscus tea steeped for at least 8 minutes. At 9:30, finish with a small warm glass of lemon water and your potassium salt substitute. Lights out by 10 p.m. That's it. 3 drinks. 1 calm routine. No complicated steps. None of these replace your medication or your doctor's guidance. They work alongside your treatment, filling in the lifestyle layer that a short appointment simply can't cover. Before you go, I want to take just a moment, because you didn't have to watch this far, and the fact that you did tells me something about you. You care about your health. You're looking for real answers, not quick fixes. And you deserve information that is honest, practical, and actually based in science. That is exactly why I make these videos. My mission is simple: to give you the information your appointments are too short to cover, evidence-based, practical, and designed for real life. Not for textbooks, not for medical conferences. For you at home tonight. So here's what I'd love for you to do right now, just 3 small things. First, subscribe to this channel. Every week I put out new videos on exactly this kind of topic, clear, useful health information that helps you take better care of yourself and the people you love. Second, share this video. Think of one woman in your life, a mother, a sister, a friend, who is managing her blood pressure right now. Send this to her. You may be giving her something her doctor simply hasn't had time to share. That's not a small thing. And third, leave me a comment below. Tell me which of these 3 drinks you're going to try first, the lemon water, the tart cherry juice, or the hibiscus tea. I read every single comment, and I would genuinely love to hear from you. You showed up for your health today. In a world full of distractions, that matters more than you might think. Take good care of yourself tonight, rest well, and I'll see you in the next one.